So for both of the candidates, would you consider Governor Otter's lawsuit against the Affordable Care Act a waste of taxpayer dollars? And if so, would you have done something differently?
I'll go first. I would not have sued. I would not have followed that suit. I believe that the Affordable Care Act is a step in the right direction. It's not perfect. Any kind of legislation that is that complicated is going to have issues in it, and we can begin to work with it and amend the parts that are problematic. But I would not have wasted money on a lawsuit.
It's tough because having hindsight being 2020, whether you would have fought that lawsuit or not, for me becomes a question about state sovereignty and state rights. And I think as a state, we should have set up our own healthcare exchange kind of a program, not the healthcare exchange contemplated by the Affordable Care Act, but something that works better for Idaho. And I think the Affordable Care Act came down the pipe because we weren't responsible as a state for taking care of the citizens who live here and make sure that some program is provided to give people affordable and quality health care. So, I would have liked to have seen the governor be more proactive before we had the Affordable Care Act come down the pipe. When it became the law of the land, was it a waste of money then to fight it in court? Once it's passed and it's a federal law, you've got to abide by it. To fight that seems to me like a waste of money. I just would have liked to have seen the governor be more proactive on the front end and put something in place so the Affordable Care Act didn't come down the pipe before we started thinking about quality health care using the resources that we have here in Idaho already.
Untreated mental illness places a costly burden on hospitals, law enforcement, and our criminal justice system. It also causes tragedy for families. What would you do to alleviate this problem? I'll let any of you.
I'll start out again. Yes, Idaho's mental health and behavioral health services are very anemic at best. In fact, it seems like our mental health program is to put people in prison. We've got somewhere, and I don't know, I've heard 80% of the inmates in the prison system are there because they've committed a crime. But the underlying reason is either mental health or substance abuse. And we need systems to do early intervention to give people the treatment for mental health and substance abuse to keep them from committing crimes and to be employed and supporting their families. About a month ago, I was at a picnic in Twin Falls, and I sat down at a table. There was a couple, they looked like they were in their early 30s, and they had a little girl with them who was probably 3 or 4 years old. And I sat down and talked to them about my campaign, and the husband, the father, said, "Gosh, I wish I could vote for you. I'll be able to do that in a year and a half." And he says, "I'm a felon." And I asked him to tell me about his experience with our prison system. He said, "I went to prison for drug violations. I was using drugs, and they put me in prison 4 times. And I said, 4 times? You must be a slow learner." And he said, "Well, I never got any kind of treatment for my substance abuse until the 4th time I was in prison." And then he was very proud of the fact that he had been clean and sober for about 18 months and was gainfully employed, was now supporting his wife and child. And that's just a tragedy that someone goes to prison for either a drug violation or a mental health issue and doesn't receive treatment the first time he's there. And it's even more of a tragedy that we don't have some early intervention to prevent the crime from being committed in the first place. And one of the things that I like about the Affordable Care Act is the 10 essential benefits of a health care plan, one of which is mental health services. And hopefully that will help us, if that is now covered with more and more insurance policies, that will help us develop a more robust mental health treatment plan and substance abuse treatment plan here in the state of Idaho.
Just a couple things on that too. First, just for the good of the group's knowledge, every single county in Idaho is a mental health profession shortage area. We lack the infrastructure for good mental health care, behavioral health care in the state. So we've got to work on this. The big three problems that most states face, Idaho clearly does, is number one, absence and lack of primary care. Number two, absence and lack of robust mental health care. Number three, the absence and lack of oral health care. So we've got a lot of stuff that we've got to fix in the state of Idaho. What's that? Oral or dental health care. So totally agree with the fact that we've got, again, a broken system. One thing that starts to work with people with mental health problems and substance abuse problems, and we care for a lot of folks over at the Family Medicine Residency of Idaho and our 7 clinics with these issues, is that, again, they've got to have a usual source of care where they can start to come in and have the problems proactively addressed and integrated and coordinated with the rest of the healthcare system. If you don't have a usual source of care and you're bouncing around like a pinball, sick in the system, mental illness sick in the system, then that is a formula for a disaster. So let me just leave one fact with you. If you have a significant persistent mental illness, schizophrenia, bipolar disease, major depressive disorder, and just one single chronic disease, diabetes, asthma, heart failure, your lifespan will be 25 years less than if you didn't have the persistent chronic mental illness. And the issue and the reason for that is lack of medical compliance, lack of usual source of care, lack of making sure that you go in, seeing how you doing, Mr. Smith, how your medicine's doing, any problems with them, any problems we can help you work on today. Those sorts of issues start to take a toll on people. So agree totally, this is a problem for Idaho. It needs to be addressed. Part of the Medicaid expansion program in terms of what Medicaid does is the wraparound services for behavioral health and mental health care. As many of you know, Medicaid has gone to a managed care contractor, Optum, for how we can try to optimize behavioral health. I'm not sure that's totally gone well. We need to dial that in. Not everything in the state does work, but again, I think what we have to do is recognize that there are issues, to continue to work on them, continue to fix them.
I just want to add that having worked as a prosecuting attorney before, I've seen the negative effects of mental health problems in the community over and over again. And the points made by the other folks on the panel are absolutely true. We end up warehousing people rather than treating them for mental health problems. Right. And when I talk to the care providers in the community, they all tell me one thing: if I could just have more time. We don't have enough time to treat the patients. We don't have enough regular contact with the patients. And that, again, is not going to be fixed just by more money from Medicaid expansion. It is going to involve reworking the system entirely. Because right now, just like we as families are turning to the schools and the courts to raise our kids in some instances, we're turning to the criminal justice system to take care of the mentally ill. And you'll find them either warehoused at a state hospital or you'll find them warehoused in prison. And sometimes the only thing they're guilty of isn't a violent crime, which would make them a hazard to the community, but just simply having a mental health issue that wasn't properly addressed. It absolutely needs to be addressed as part of reworking how we deliver health care here in Idaho.
There's a question about the jobs that would be created. Dr. Epperly, maybe you could speak to that a little bit and how this funding creates a ripple effect.
Yeah, it's a good question. So again, for every physician in the state, roughly they bring into their community about $800,000 to $1 million in terms of income that is spread back to people in their offices. That supplies on average about 7 to 8 jobs of people working per physician in the state. There is a derivative downstream benefit in terms of labs, x-rays, services in the community, physical therapy, etc. The issue in regards to Medicaid funding in the state is that $2 billion, and I'm just using 2016 round numbers, then goes to continue to support, as we start to revamp the system and care for the people of the state, then jobs for people to continue to do that. If the money disappears, totally gone, money then being sucked into other sectors of the economy to make sure those sectors work, be it education or transportation or bridges or roads or whatever it is, then we're looking at a scenario in which hospitals suddenly have markedly less income. Potentially physicians make choices then on either reduction in size of staff, etc. That's where the job potential loss comes. Now, I recognize we've got to reform and transform and re-engineer this healthcare system. It has to be more efficient. It has to be less costly. Nobody disagrees with that. But if suddenly you unplug a $2 billion 2016 allotment then that comes to finally care for the people, start to get many of the things that we're talking about under control, then all of a sudden there's a large job reduction. So that's why the numbers that I quoted to you, and again, were talked about in the Medicaid expansion work group, are as follows, just so that we can make sure that you hear that. Of the $2 billion 2016 money for Idaho, it creates $1.56 billion in wages to Idahoans, 43,000 jobs across the state in regards to working then on people that are part of the Medicaid system. And I should say, the redesigned Medicaid system. We're not talking about trying to force people into the broken system. It's an important point for you to hear. Again, Mr. Bujak is right about the fact that if we cram these people into a broken system, shame on us. But it is not current to continue to say that, because Idaho is working to transform that healthcare system. And I want the audience to understand that. And $132 million in taxes that then comes back into the state that helps, again, the state with its revenue streams to then pay for the other things that are part and parcel of our state, such as education, transportation, roads, bridges, etc.
I just want to point out, again, it's my concern with the Medicaid expansion before we're ready to go here, before we have a system in place. We're talking about jobs creation. What nobody wants to talk about, though, is what happens if the federal government pulls the plug and the money doesn't flow in as we expect. The other thing that you've got to watch out for, well, it's happened before. I mean, I see people shaking their heads, but it's happened before, and like with the wolf issue.
Medicare.
Well, Medicare too. I mean, Medicare, the hospitals are getting less for Medicare under the Affordable Care Act. Oh, no. But I'm saying there are times in the past when the federal government has pulled the plug, and I think we just need to go into this with our eyes open. Where's the plug pulled? It's when the federal government stops sending you money. Are you talking about in the medical care? I can't name one in medical care. I can't name one. I'm talking about the management of wolves in Idaho. They just left us with that. I'm saying there are things that have happened. No. I told you, if you're asking for a medical care example, I can't give you one. Because I do believe that, I do believe the federal government can be tricky, and they withhold money from us.
Social services example.
Well, I'll tell you, I mean, I can look down the road and see things that cause me
No, in
concern.
the past, because you said they pulled the plug.
No. What I said is they pulled the plug on other programs, and I told you about the wolves. I said my concern going forward is that the money might not be there, because the federal government is spending irresponsibly. Well, and I mean, we can agree to disagree. This is the two sides of this debate as it continues to go on. But to just say the money's going to come in and create these jobs, that's a projection. Just like it's a projection for me to go forward and wonder if the money's going to be there. We don't know, is my point. And I think we need to be cautious. Same thing with the jobs. I mean, you're talking about the jobs that I think we're talking about is jobs in administering the program. So we're just going to make the program bigger? Well, the healthcare workers aren't here in the state. We don't have doctors here who are able to take care of the patients. I'll tell you, we would have the money if we changed the delivery model. And before, right, we have to work on that. And before we do work on that and have it done, we can't just guess that it's going to be there. And guess that the federal government is going to continue to keep funding a program that's going to be so expensive. And understanding that eventually Idaho is going to have to pick up the tab on some of it.
We already are.
Well, we already are on 30% now. Well, we're going to have to pick up on 10% of the expanded Medicaid after 3 years too.
We're on the hook for catastrophic health care now.
Well, we're already paying for it using the indigent funds and the CAT fund.
And we're just.
And our insurance premium.
And why don't we take that money and apply it to a better model and stop spending all the government money?
Why not spend the government?
Time's up. Thank you.
So if we pull
Alright.
the plug, we're where we're at right now, then, right? We're basically where we're at right now.
Well, where we're at right now is with the broken system. We all agree on that.
Okay, so we go from, if they pull the plug on it, then we're back to a broken system.
All right, we're going to move on to the next question. All right, okay. This is a question about why I think this issue is difficult politically. It's why do you think a fiscally conservative state like Idaho, where we'd like to save Idaho tax dollars, is not recognizing the monetary benefits of expanding Medicaid, or we haven't yet?
Lauren, could you repeat the question?
Yes. Why is a fiscally conservative state like Idaho not recognizing the monetary benefits of taking these federal dollars?
I'll take the first shot at answering that. I think, like a lot of things, when you have a one-party monopoly and you don't have a great discussion, you get blinded by ideology. And I think that's what's happened, that they... People that are in the legislature are so concerned about being dependent upon the federal government that they've just taken that stand that they don't want to expand Medicaid. And you're seeing the pushback that Governor Otter is getting because we have a health care exchange. That too makes a lot of sense, and I am in favor of that also. We need to be much more pragmatic, and I think we would be if we had more balance in our state government. A one-party monopoly really doesn't work anywhere in the world.
I'll approach the mic with trepidation this time. I think one thing Idaho has to recognize is you're dealing with a Republican-controlled legislature regardless of who's in the governor's office. And whatever is going to come out of this committee and ultimately be recommended is something that's going to have to be sold to the legislature. Like you heard the good doctor say, the legislators on the committee thought that it was a no deal. They wouldn't be able to sell it. And you can sit here and scoff at me and my ideas, but what you hear from me is some of what you're going to hear on the floor in the House and the Senate when they debate this. And the reality is, whether your perception is different or whether you think it's silly, there's a lot of people who are in the position to make those decisions who absolutely believe it's true. And so if you want to see quality health care come to Idaho, and you want to see better health care delivery, it's got to come through the restructuring of the way we deliver health care in Idaho. Because if you try to sell Idahoans, because we're a conservative bunch, at least the folks in the legislature are a very conservative bunch, they are going to fight accepting federal dollars. They are going to fight expanding government programs every time you turn around. And so, you know, if Mr. Balukoff wants to go in there and make this happen for the Democratic Party, he has an uphill battle all the way.
Why aren't you protecting my tax dollars? That's what I want to know. As a conservative, why aren't you protecting my tax dollars?
Protecting which tax dollars?
My tax dollars that could go, my taxes could go down if we expand Medicaid.
I don't know that I follow that logic. We're spending more federal money that we don't have.
No.
She's talking, John, about the state catastrophic fund and the Idaho County indigent funds in terms of both state property tax or county property taxes and state income tax.
Sure, well, and I think we could get to a lower tax base anyways, again, by restructuring the healthcare system. I tell you, the answer isn't just to ask for or take from the federal government a bunch of more money. That isn't the answer.
But the federal government's giving it out anyway, that's not gonna change.
But isn't it irresponsible
It's
for
my
us
money.
to take
It's
it?
gone to the feds and they're offering me some
Well,
back.
we've given them $1, we're getting more than $1 back.
Yes, I want more than that.
I think if we continue to think that way, we're gonna spend ourselves into a deficit that we'll never recover from. And I think that's just gonna be an ideological difference between us. I just don't think it's the right thing to do, to take more money from the federal government that we don't have as a people here in the United States and throw it at a broken system.
Well, we need to restructure our healthcare system. We also need to restructure our legislature.
Okay. Community health centers such as Terry Riley have become an integral part of offering care to low-wage earners in Idaho. With healthcare reform, what are your positions on community health centers and Medicaid reimbursement?
Yeah, I'll go ahead first. The Terry Riley Clinic in Canyon County, I love it. I think that's a great delivery model, and I think it does a lot of good. And
But it's a long time to get in there for lower income people who don't have coverage.
sure, and that's the problem, because we don't
Right.
have enough access points.
Yeah.
So that's what I'm talking about. I really love this direct primary care model, but to set it up with these local clinics like
Right.
Terry Riley, again, people that are there for the right reasons, caring about people in the community, having relationships with
Right.
patients. I love the model, and I think that something like that could fit right into the direct primary care model.
The community health clinics like that fill a needed role in our community, but the consistent problem that I see with them is always funding. It seems like they never have enough money to keep things going. They depend a lot on philanthropy to help pay the bill. So getting more people covered with insurance would provide more funding to those community health clinics like that. And that's the direction we need to go. And there's a lot of them. Terry Riley is one good one. There's I think it's the Genesis Mission in Garden City is another one. There's a number of them that provide that valuable service, and they need to stay here. But again, their main issue that, from my point of view, and I saw this when I was on the Children's Home Society board. They do business as the Warm Springs Counseling Center, providing mental health services to children and their families. Finances was always a struggle, and they had to depend on philanthropy in order to balance the budget.